everybody. I'm happy to be here today to present a little bit on how my abdominal and natural massage can actually assist with fertility techniques as well. I work at a clinic called Centered Spirit. A little about me first before we get started. Alex Jackson is my name. I've been in Kansas City practicing for over 10 years, special techniques from the Mayan culture and along with natural remedies as well. Having over 9 years experience practicing in women's healthcare. Specialized in abdominal therapy, assisting with reproductive techniques, digestive disorders, emotional, and a lot more. Focus today is going to be on how we can work with fertility with you. First of all, some of you may not even have heard of how massage can help with fertility, and it may be kind of foreign and lost into a lot of numbers, statistics, and all this. But what is my abdominal therapy for one? Well, it's a gentle massage coming from an external point of view, allowing reproductive, digestive organs, and everything in there to go back in its proper position. Where it comes from is from the Maya culture. My mentor, Rosita Arvigo, Dr. Arvigo, has learned these techniques from traditional healers, midwives, along with her knowledge of Western medicine to bring it here today. We found through examples, her mentor would say too that woman's uterus is out of place and everything else in the body will be also. So as you'll see what we're going to talk about today, with the position of the uterus is great importance for what your fertility holds in store. Just a few examples to go over the slide. Back one. Oh. Sorry. Would be, that's okay. Just so you know, I'm not going to spend a lot of time on statistics because you've probably got a lot of that going on in your head right now about numbers and everything. But male factor, female factor for fertility would be about half, 40% is female, 40% is male, and a bit 20% unexplained. Along with that, next slide would be going into further depth as far as the female factor is concerned. We talk about cervical factor, which is what Angela was talking about, cervical fluid a lot. We're talking about tubal disease, opening pathways for the fallopian tubes, making sure that it's healthy. We're also talking about endometriosis, which is a big category of fertility. 35% with ovulation disorder. You have to ovulate regularly. You have to make sure that the egg is healthy. All of this happens. A lot of this can be addressed through my abdominal therapy and through massage. And also, about 10% we feel find is unexplained. All this pie chart coming out too, as we talk about these symptoms, once your heads are going to start going about how this massage can work with these. So, what's the basis of fertility? What I want to explain to you, what is your uterine health? Also, so for fertility, for me, what equals fertility is a healthy menstrual cycle, right? Is what's happening. What is healthy to you? Your definition of healthy might be less ibuprofen this month, but it could be that your days are shorter and longer. It could be that you use less heating pad this month. But is that optimal health? Is that actual health for your menstrual cycle? If fertility is a byproduct of your menstrual cycle, then we need to work on your health and fertility through your menstrual cycle. So this is how this massage helps. Have one of those conditions, I'm going to show you my
visual here, because I think it's very good to get a visual.
There you go. Have you ever heard the term maybe tipped or tilted uterus? Anybody? Okay. Well, has there been anything you've ever done for that? At an exam, maybe you've heard that term? Has anybody ever told you what to do about it? No, I'm not going to see them. You see the hand range real fast, right? Maybe stand your head, maybe that does it, or do yoga moves or something like that, right? Well, with this therapy, it's the only thing that is really non-invasive to do to help with that position of the uterus, okay? Your uterus, just a little bit of health, next slide, would be, there's different degrees of the uterus could be tipped, tilted, where there's tips backwards, forwards, retro, down, low, sideways. We're just going to be simple about that. those tips or tilted display shooters directly affect your cycle and your fertility in that nature.
But I have a pelvis here.
And the uterus, here's a little bit of anatomy on the next slide. It's about 3 inches. This is actual size of weight. I'm going to pass this around so everybody can feel because it's a very good visual in this sec here. But actual size and weight, non-menstruated. This is about 3 ounces, and 4 ounces to 8 ounces. This is the size that it grows during your menstruation. So the size gets diminished, but also, if we look at a pelvis here, just on this slide, it's held on by about 8 different ligaments. Your uterus is. So the uterus can shift and move, of course, right? It has to grow for pregnancy. It has to hold that baby in there. So those ligaments can move around. Well, there's causes for that too, why that happens. Maybe the uterus you've been bald on your tailbone or pelvis and has jarred that. It can be scarring from surgery, traumas from that, surgical. It can be emotional traumas. It can be the way aerobic activities in some ways. It gets jarring here, but there's many causes that come with that. What massage does is help put the uterus in a better position. The uterus, for example, can be tipped backward, retro, be tipped to the side, just like so. And if it's tipped to the side, if we look here on this slide, right to the left, to the right, what's on the other side? The ovary, right? The ovary is very crucial for pregnancy. So if it's doing that, maybe it's tipped on that side and ovulation is not happening as easily. Spontaneous ovulation is occurring. Hormones not getting to it. The signals are being blocked in different ways. So this is bringing her back into a correct balance. I'm going to pass these around so you guys can look at these and just feel, because it actually does a good visual so you know what's, your uterus is like. Again, 4 ounces to 8 ounces menstrual. It's non-menstruating. So the size and the space is also diminished inside this pelvic cavity with that. Position is important. The next slides that you have is going to be a list of many symptoms related to the displaced uterus. And some of these you're going to look on here and say, wow, these I might have like 10 of these. I might only have 2 of these. But one is too many, if you will. One is too many. What my practice and my background tells me is that my teacher says your menstruation should feel like maybe about 30 minutes of slight, maybe you have it like a little cramp here, but it shouldn't be debilitating. It shouldn't feel like it's heavy. It shouldn't be like I can't go to work. All these things that we're doing. Some of the highlighted ones on here are some that may be directly related more to fertility. So late or early irregular cycles, it's great, like Angela said, to know your charting and some of these things that we're talking about, to know where your cycles are. What do you do about it? I've had women too that come in for their luteal phase is too short. They can't sustain a pregnancy. The hormones may not be getting there and telling the brain signals to the uterus what's happening. By doing this massage, doing this correction, we're able to establish that and achieve pregnancy. True story with that too. Failure to ovulate regularly, we just kind of mentioned that, is how maybe the uterus position can directly affect your ovulation and uterine health. Next one, endometriosis can affect that too. A lot of women, again, that's a big thing with fertility. They're having trouble at laparoscopies also too, which creates scar tissue. So clearing scar tissue out is a very thing too. There's not a big, surgery creates scar tissue, but what do we go in to fix that? Sometimes more surgery. There's no replacement. One of the things that my mentor said, there's no replacement for the hands. So the herbs have no hands. And also through many other types of drugs and everything like that too. Sometimes you just have to get in here and unwind things. So PCOS, polyps, fibroids, uterine infections, anywhere infection is in the pelvis, it means that there's not that health, there's not that chemistry going between your body and the corrective reproductive system. For example, if you have this beautiful womb that needs to be nurtured, just like a garden is, it has to get the water to it when you're watering your garden. Well, if there's a blockage, there's a kink in the system somewhere, we're not going to get that nutrients to the soil, to the uterus. And more miscarriage happen that way, and the uterus becomes incompetent, and it can't work as progressively as it needs to. So the function gets thrown off. pain of ovulation, failure to ovulate, knowing when you ovulate by charting, but is there reasons why too? Is there not only hormonal reasons, and opening these pathways up is very crucial. So, infertility, again, I believe Angela mentioned this, that there's a symptom. These are symptoms. Not necessarily, fertility is a symptom, but it's not necessarily the cause of things. We're addressing the cause by doing a simple myoabdominal therapy massage. You're actually treating the cause, and hopefully taking care of all these symptoms on here by then working with your fertility. Right, miscarriages, also. So ways that this myoabdominal therapy can help you increase fertility. One is putting the uterus in a better position. Alleviating congestion around the abdomen, removing adhesions. Sometimes when the uterus has been there for so long, it creates a sticky sort of connective tissue adhesion in that area. By doing a simple massage, it can actually help open those channels back up. At the same rate, we are helping to regulate hormone levels. Now, the hormones have to travel through all parts of the body, and they've got arteries and veins and through that. So we can increase that. We're going to increase chance of fertility again. Achieving a healthy, regular menstrual cycle, and build a vital connection between you and your womb. More on that in just the next slide. So what does this look like to you? Right here we have cars. Imagine those cars and those highways. We've got one highway going to where we need to go, one guy going back. The arteries and veins, right? Let's just say picture those arteries and veins in your body. So those cars, let's picture them as hormones, nutrients, oxygen for your blood system, to your womb, to your uterus. So very congested, very hard to get to where they need to go in these signals. By opening things up through this massage, through myoabdominal therapy, we're removing these cars. We're removing these hormones. We're helping clear the roadways and pathways. Next. Another one, there's debris. There's power lines here, which are nerves through the system. They can't get the signals they need to get to between your brain, between the hypothalamus, between the endocrine glands, between the hormone levels. By clearing this out, by helping to remove debris, there's snow, but it's also what's accumulating as far as toxic environment that happens in your menstrual cycle. We can actually increase fertility through that. And the next one, this is what we want to achieve. Open highways. Open communication between you and your womb. And between you and your cycle. Getting to know your body naturally and working in that way. Again, myoabdominal therapy helps to open these highways and signals, these arteries and veins. Vitally crucial for the hormonal feedback loop between your system and your regulatory cycle. It also helps balance those hormones. Reproductive nutrients, hormones, vitamins, oxygen, waste removal is so important too. One of the big conditions that we have with cramps, when you're having cramps in your cycle, is because too much acid has built up in the body. You ever heard like lactic acid when you're working out, doing muscle training and doing workout? The same thing happens internally in your uterus because you have too much acid built up, which you get more cramps. So if we alleviate that, again, it's another condition we're taking care of with natural techniques. So here's something that I want to stress is so much important. Just as far as we're talking about the physiologically of your body, we're talking about stats, talking about numbers, we're talking about progesterone, estrogen, all these things that you may hear about this today, and you've heard about from the fertility journey, is the mind-body fertility connection. I know that through your journey on this fertility journey, some of you have been very frustrated with the body, and is it working? Am I doing something wrong? What is actually happening? And not having the answers, and that's why some of you are here today to get more answers with that. But there's also a vital connection between you and your womb, which is beyond what day things happen, beyond what hormone levels are what, beyond when we're supposed to have time to, I'm ovulating right now, I gotta make it happen, I can't have this to eat, I can't do this. But there is that connection that is so important. That faith that your body can do good for you, that establishes that. A lot of times we forget how touch can be effective with that. By doing this massage in the abdomen, we store so much there, history, past history, connectedness, and going through that, that we want to make sure that We are, what time?
Yeah, 5.
5, okay. That we work on that as well. And I can't tell you how many people that I've worked with that find that so comforting to me that it is also the key for fertility. Next time, again, invites women to awaken and feel. Feeling is important. We don't want to just be in the head. Our body has to feel as well. It has to feel and use intuitive senses also. Where connecting creates empowerment and healing. Awareness is healing. Once you're aware of your body has more empowerment, and you can make decisions, it can produce things for you, and get in a better cycle rhythm. My abdominal therapy, whether you're working, sometimes some people might come and say, okay, this is only natural for me, and this is only natural, which is fine too, but some also might find it useful doing assisted reproductive techniques, which you've heard about today, whether it be IUI, IVF, anything of that nature. How does it help with that? How is it going to improve that technology as well? Well, by opening those channels we talked about, those highways, those hormones have to get where they're supposed to go too. A lot of reproductive endocrinologists use hormones to increase the ovulation, put you on different cycles for the retrieval implantation. Well, if there's congestion, ovarian artery branches off way up here by the kidneys, not by the ovaries. So if congestion anywhere in the abdomen, it's going to affect that. So,
Oh, sorry.
That. Not to leave out the men. There's men here too. My abdominal therapy does help with men too. Now, when there's congestion in the abdomen, it can affect prostate health, which is used to help with clotting factor, reduce acidity, also for the semen, and helping the sperm survive. It can also, in fact, help with any types of motility or morphology in sperm if there's any congestion or hormones not getting where they need to go. And also improve just general pelvic health. And then so we see an increase also if the couple comes together. We also want to address the men and make sure that we're tackling both ends, if you will. It increases both. Yes. So these are some other natural ways you can work with fertility naturally. One is my abdominal therapy. Acupuncture, charting your cycle, or NaPro technologies. Also nutrition, yoga, exercise, meditation. And those are all places you go to. You usually see someone, do something. But the other thing is also connection, lifestyle balance from within, what's within, and that comes from usually working on these other things. It's all a balance with that too. Usually in a session, we actually do a 2-hour treatment. We see someone the first initial session. It is a complete consult, medical history, uterine health history, all this menstrual. We look at what's happening in your body, explain to you what's happening with your specific cycle. All the symptoms that we discussed on here, or you see on the chart, would be something that you can, why it's happening to you. Okay, uterus to the left, maybe it's on ovulation, what's happening. We also do a treatment to you, then show you self-care techniques that you can do at home to aid this in a natural way, enhance it. Any possible recommendations that would help out along the way also. It follow-ups for generally an hour, so the cost is very minimal compared to other techniques, if you will. And that's it. The information, we have more information there. We're going to pass out on your way out. Pick up, I didn't get it passed out, but pick out a handout that has the slides, on here. I know we have a small time, but a lot of information. We could talk for hours on these techniques. But the general idea to help with natural way to put in your own hands how you can work with your cycle to improve your fertility in whichever way we're here to support you with. Again, whether it's natural or assisted reproductive, support you on any way you want to work with that when you come into our clinic in Spirit in Brookside. Okay? Now I'm going to bring Angela back up. If you have papers which you want to pass up, if you have any questions, just pass them to the side. We'll take a question. We have about 10 minutes to go over questions. We have a couple minutes, right?
Probably like 2 questions.
About 2 questions. A couple questions? Okay. We're going to take a couple questions. We'll look at them, see if there's anything on there. If you guys thought of anything, come back. We'll be at our booths too, but we're going to see if we go. Okay. Good question is, does it hurt? And is it, a lot of women aren't used to getting where, or anybody rubbed on their tummy, right? You get a massage somewhere and you're not used to that. Well, I like to say it's therapeutic in a way. Just like you have soreness in your back, your neck, you get it rubbed out. Well, there can be tension there. We're not used to those feelings. A lot of women aren't used to the feelings of their abdomen. It's not like we're going in there and being really, some areas are going to be more tension, some are going to be less. But our idea is not to cause total pain in a way. If I see that your body is tensing up, we're not getting anything released. We want to do a therapeutic way to where you're letting go and opening channels back up. So that is, like I said, everything can always be different therapeutic ways and things like that too, but we're not here to cause pain to get things to close up. One other question on the same thing is how many sessions does it take? I would recommend at least 1 to 3. Maybe a 3 is a good parameter because you're working with cycles. You're working with, okay, you see one thing of fertility would be next month, seeing women change all the symptoms they have, as you saw on here, diminish. Next time, okay, I took electrolyte ibuprofen, next cycle, they see that. Next one would be I get to see less pain in my periods, and next one, the blood's brighter and everything. So those are all good symptoms. After about 3, your body starts to reestablish that in the hormonal feedback loop. So about 1 to 3 cycles, I guess, would be a good, about 3 is a good remedy for that, okay?
Okay, I have 2 questions. If the majority of our infertility is male-related, will the system be worthwhile? Absolutely. By necessity, when you learn to chart and focus on the woman's cyclic fertility and infertility, because that explains the fertility of the couple. But if you're dealing with male infertility, at least knowing the times to try and focusing, that fertility-focused intercourse that I talked about, the specific times when the mucus is present, that can only benefit the situation. And then we can refer you on to a urologist and, kind of work with them hand in hand. So it can benefit. We don't have any, we have a few. We're working on research of male-focused treatment, but we're just getting into that right now. And then please explain approximate out-of-pocket treatment costs versus insurance coverage. To learn to chart the system, an introductory session is $40. A follow-up session is $40. Your first year materials are $40. So that first year, 8 follow-ups and intro, you're talking $400. Insurance companies, we do have insurance codes and things like that, so you can, a lot of times people have the most success turning in a receipt to their insurance company, making their own claim, or working with a health savings account or a flex spending account, things like that. Now, treatment costs, that is dependent upon the doctor and your insurance and things like that. In my scenario, we have pretty horrible insurance, and it just varies on who you're seeing and what your coverage is. But it's just like going to any doctor's office. If you're going to do some blood work, have a consultation, maybe $100 for a consultation, and then insurance, things like that. But simply learning the system, we are a nonprofit organization, so it comes in, you're paying for that session, and in my opinion, pretty minimal considering what some other things cost. So $400 first year just to learn, and then the doctors and their offices can answer those questions a little more closely.
I would say we take flex spending accounts, health savings accounts in my office as well. We don't bill their insurance directly. We can provide you with information about receipts if you get reimbursed anyway like that too. You're looking at probably about a 3 visit cost, probably under $400. I mean, for that first session is about 162 hours, around $90, and follow-ups from there. So you're looking at, again, even if you were to do this for 6 months or something like that, getting your either in health in line, you're still looking at a very minimal cost compared to a lot of things out there, and even combining it with natural growth technologies, it's probably you're looking at $1,000 sometimes compared to thousands of dollars.
And another note, we're a nonprofit and we don't turn anyone away. So if you cannot pay full price, we'll work with you with a sliding scale, which is that you pay something. If that's $5, then that's $5, and we'll work with you. So, it's wonderful, and we do have people that that's all they can afford. But we want to offer services to everyone, so I'm glad to work with you.
If there are any other questions, please feel free to stop by their booths. You're going to have a little bit of break to go to the restroom or grab some more food, and then we'll meet back in the main room.
Thank you.
Thank you.